Hey everyone, it's Dr. Konrad Saroshik here at Cool Springs Plastic Surgery. I have another very exciting story to share with you about today about a patient who came to see us for a mommy makeover. A mommy makeover traditionally can encompass a number of different procedures. Things stemming from facelifts, blepharoplasties, to breast surgery, to abdominal surgery. That whole gamut of surgeries is created and put into a portfolio for you when you meet with a plastic surgeon during your consultation. Our patient today came to see us, and you can see her pictures behind me here, with a complaint that her breasts and her belly were the two areas that really bothered her. These two areas, and you can see here, her breasts here are very ptotic in the medical term, but actually it means droopy, and you can see how they're hanging down. Her nipples were enlarged and they were very asymmetric, so you can see that her nipple on the right is a little bit lower than a nipple on the left. She wanted to have her breasts up, more full up on her chest, but also to have her nipple be symmetric and the same size on both sides. And then her abdomen, she was very concerned with what was going on here at the bottom. And this is that infamous C-section scar that a lot of women get during the delivery process. This scar acts to tether the abdomen, and all the tissue above it that you see here gets anchored right along that point and tends to overhang. It's virtually impossible to fix on your own, and surgery is one of the main methods and main things that we have in order to be able to fix it and make it much better. So what we did for our patient here, who's a mom of 3 kids by the way, is we performed an augmentation mastopexy. You can see we took her breast from her preoperative photo. Here's her postoperative photo, and you can see the shape change. She went from a breast that was very, what we call droopy here, to a breast that's much more higher on her chest. Her nipples are smaller and in a much higher state, and they're also symmetrically aligned. So breasts were done, and now let's take a look at her belly. Her abdomen, we talked about this C-section scar. We were actually able to come down below the C-section scar during the tummy tuck and cut that whole scar out and remove all that tethering. We were also able to remove and debulk a lot of the tissue here in her mid-abdomen to give her a nice contour. Now, during an abdominoplasty, you might hear this term called diastasis recti. And what diastasis recti is this. Your rectus muscles are 2 muscles that basically lie up and down in the midsection of your abdomen. As your body accommodates the baby, which is growing inside of your belly, those muscles get pulled apart, and you can see here how they're stretched out and pulled apart to the sides. After you deliver the baby, this does not recoil in every patient. A lot of women battle with postpartum fullness, bloating, a lot of distension in their abdomen. They feel like their bellies never get back to that pre-baby state. And largely that can be attributable to this diastasis recti. So what did we do? We actually fixed her diastasis recti by doing this. We pulled her muscles back into the midline, and utilizing sutures, we actually were able to sew them together, closed in a nice fashion. Now look at what happens to her body. Her body bulges out like in the preoperative state, and look at what happens now. She develops that beautiful hourglass figure that you can see accentuated here. That is all accomplished by pulling those muscles into that midline and giving her some of those curves back that she had before the operation. So again, belly before, belly after. Plication of that midline, that diastasis recti, and we coupled that with, on this particular patient, with what we call flank liposuction. And we basically went and removed a lot of this extra tissue right here in her abdomen. We made 2 very small incisions on the back, and utilizing the technique of liposuction, we were able to produce this. And this is amazing for women, especially when you're wearing clothing, pants, shirts that are tight-fitting. It helps to, again, convey that beautiful hourglass shape around the hips and the waist. And it helps to really regain some of that curvature that she had prior to her pregnancy. So I hope you learned a little bit about what we call the mommy makeover. Again, the big thing really is to meet with your surgeon, discuss the procedure, and help them sort of build a portfolio of procedures to make this a custom-built thing for you and your body and your goals and your desires. Thanks so much for joining me, and I hope to see you next time.